what solidarity means. Azerbaijan is the country, and President Aliyev personally is the one who came to Bosnia and Herzegovina with the help when we were in need. And it says a lot itself. It says, I mean, forgive me for my, let's say, privilege to use this opportunity to thank to the country of Azerbaijan to helping us, and President Aliyev, who was helping us directly with the support of vaccines and medical supplies when we were in real need. So without further introduction, of course, someone who represents this country in this area the best is Minister of Health, Mr. Teymur Musayev, and I was joking to him, if time machine exists, I would probably introduce him by saying Robert De Niro when he was younger, I mean, is with us, and so here we are. Please, Teymur, could you take the floor, and thank you so much.
Your Excellencies, ladies and gentlemen, first of all, I think the main message that we shouldn't forget that we are on board just one spaceship called Earth. So the question of multilateralism will be vanished immediately. Almost 3 years passed since the moment when World Health Organization declared state of emergency in the field of public health due to outbreak of COVID-19. Now it's time to discuss the lessons derived from management of this pandemic, although we are far from the end. At the same time, the lessons you may already heard today, I will take courage and to be focused on some of them. The first lesson we learned is that the spread of infectious diseases is a global matter because of advanced globalization. Unfortunately, some countries took away to defend the health and to take care health of their own citizens at any cost. The second lesson is that intellectual property rights should be waived when the health is a matter of major concern. All member states of the WHO should come to consensus and sign legally binding documents, but at the same time, nevertheless, the proper financial support and awards should be bestowed for scientists. Third lesson is that citizens to government trust is a key component for pandemic response and management. Governments' transparency and accountability ensured public trust in prevention measures and vaccines. Only countries with strong IT infrastructure succeeded to provide high-quality education at any level based on distant learning during the pandemic. Until now, education is one of the most vulnerable parts of our lives globally. Fifth lesson is that government's maturity is a key factor for agile combat strategies and quick reactions in response with pandemic measures. The experience of the Republic of Azerbaijan was several times acknowledged by high-level representatives of many international organizations. For prompt implementation of preventive and urgent measures, by the guidance of the President, His Excellency Mr. Ilham Aliyev, the task force was established under the Cabinet of Ministers. In a short period of time, hospitals' bed capacity were increased, all the necessary medical equipments and medicines were provided to all the medical facilities. From the first days in our country, all measures were done in strong collaboration with the World Health Organization. Sixth lesson, and I will especially would like to attract your attention to this point. One of the core unpredictable social and medical complications are mental health deteriorations that don't recognize ethnic groups, nationalities, and that have the same development dynamic during and after spring of pandemics. Due to lockdowns and depression, the number of mental issues incredibly. Psyche resources were vanished. Until now, humanity hasn't recovered from it, and this has incredible impact on perception of other global threats like wars, starvation, and climate change. And finally, the seventh lesson learned, that new benchmark for healthcare professionals is already set up. The benchmark based on absolute integration and unification of biomedical sciences and information technologies. Healthcare landscape were dramatically changed due to big data flow. The urgent need for new medical professional staff that would combine perfect clinical and research minds with capability of riding the most advanced technologies of digital world tops the agenda. The World Health Organization has named vaccine hesitancy as one of the major global threats. The Director General stated that we are not just fighting pandemic, we are fighting infodemic. Profit-oriented perception of infodemic brought uncontrolled flow of unproven and sometimes socially dangerous information to all media users, and all of us were witnesses of that. The fighting of misinformation is a common task and common responsibility. Media has no rights to broadcast scientifically proven and unproven information at the same basis. And we have to come to certain legal points to sign certain documents to somehow regulate it. Because during the COVID-19 pandemic, we've seen the flow of this information that basically totally distracted population later on. From the starting, it was the mask story, then we come to anti-vax movement. Being a doctor, I would like to explain in a simple example how its influence on human psyche. When we announce the diagnosis to some patients, they pass through 4 stages. It doesn't matter what kind of disease it is. First, it's shocked. Second, it's neglection. It can happen with me. Third, it's acceptance. And only fourth is okay, I'm ready to fight, please help me. And this is right not just for individuals, it's absolutely right for societies, for communities, unfortunately for countries. And we've seen many times when countries behaved immature in this way, especially with pandemic. To address misinformation, government of Azerbaijan has shared accurate, clear, and easy to find information regarding all aspects of COVID-19. Strong public campaigns were carried out through media, civil society, medical and educational facilities. Another lesson learned, and this can be, I think, like a global trend, that proper and on-time big data analysis is a key factor for the right decision-making, and for this, kind of governmental platforms should be established for on-time and proper data exchange that would lead to each government in each country to have to the right decision in the right time, and at the same time to be interdependent with other countries around. What we've seen during pandemic, these chaotic decisions basically postpone certain proper steps to be done. To resolve this, applying transparent and cyber-secure augmented reality and artificial intelligence technologies is the only way to get global coordination of early warning system, transmission tracking, and as well as sharing vaccines, medical devices, medicines, tests, etc. There is a strong demand to go beyond the health and to address the socio-economic determinants of the health. It's time to invest, to do the proper investments in healthcare systems that let us to provide strong social background for resilient and sustainable economies to be ready for possible future global threats. The scarcity of resources and some limiting factors like commercial-based vaccine production is another two challenges to be addressed, especially in developing countries. We would like to declare that we see the World Health Organization as the highest authorized international health institute with new approach regarding its financing in the view of global health economy and global pandemic economy. The absence of viable global pandemic policy pushed many countries to consolidate around certain initiatives like COVAX. We should clearly perceive that COVAX is an initiative that faced with unfair and wild market rules that hardly compete with global humanity demands. Today in Azerbaijan, we celebrate the Healthcare Workers' Day. And me as a Minister of Health, on behalf of all healthcare workers of my country, wish you strong health, bright mind, and collective prosperity. Thank you.